and I want to thank the members for allowing us to bring our suggestions to the Energy and Commerce Committee and this subcommittee on health. I appreciate your time and the leadership of Chairman Pallone and the committee in this 116th Congress. As we meet in the room named for the champion of health care, Mr. Dingell, and as I look at Henry Waxman looking down on me, I know that there are giants in this committee that have done much for health care over the years. I am a proud sponsor of H.R. 117, it's an acronym, Newborn, and that's Nationally Enhancing the Well-Being of Babies Through Outreach and Research Now. Pretty good acronym, thanks staff, which builds from the belief that health care is a basic human right. The newborn bill was introduced way back in like 2010 or 2009 the first time, and it was part of the Affordable Care Act, and it would have been included therein, but for some mistake that Chris Dodd made, and I haven't forgiven him. The Democrats used it as a way to promote the health care, and it was a highlight of what we were doing, put out to members that we're going to have this Newborn Act as part of the health care bill. I guess it's when we had to deal with the Senate bill that we had the problem. The Newborn Act gives a voice to children who have been taken by our country's ongoing crisis of infant mortality. 54 developed countries have lower rates of infant mortality than the United States. As the wealthiest country in the world, the United States, we should not be 55th. As members of Congress, we should be ashamed. In fact, John, whatever his name is, The Daily Show ought to be here giving us hell. Yeah, Jon Stewart. The Newborn Act would help address this problem by creating infant mortality-focused pilot programs in the highest risk areas of our country. The pilot programs would focus on addressing the top 5 reasons for infant mortality: birth defects, preterm birth and low birth weight, sudden infant death syndrome, maternal pregnancy complications, and/or injuries to the infant. These deaths disproportionately affect black women. My district is predominantly black and predominantly black women. It's estimated that 9 out of every 1,000 children born in the district will not see their first birthday. By focusing studies in the highest risk areas of our country, the Newborn Act directly confronts this disparity. Its pilot programs would provide insightful data and immediate support to areas with the highest rates of infant mortality. So I would encourage the committee and ask the committee, beseech the committee, to have a hearing to consider the immediate threats the maternal and infant mortality crisis poses to women and children, especially African American women. It's our duty to act, and I believe the Newborn Act would be a crucial step forward. I know Dr. Burgess knows these issues too. As a pediatrician, he sees it, but it's really awful in Memphis. We have rates with third world countries. So that's my ask, and I appreciate the opportunity to address you.